Hi, in this video I'm going to explain why women with PCOS will benefit from eating a low-carb diet. First, let's understand the hormonal imbalance in PCOS. Polycystic ovarian syndrome or PCOS is characterized by the absence of ovulation, excess of androgens and the presence of polycystic ovaries detected by an ultrasound. There are different types of PCOS that are marked by different combinations of these three biochemical or clinical signs. To simplify, it is an imbalance of hormones causing fertility and metabolic issues in women of reproductive age. Now, when we speak of hormones, we are referring to the female reproductive hormones, that is estrogen and progesterone, the androgens or free testosterone, which is normally dominant in males, and two other significant hormones, which is the insulin and the thyroid hormone. Let's begin with the insulin defects that are seen in PCOS. Now, PCOS is associated with insulin resistance as well as defects in insulin secretion. These abnormalities, with or without obesity, explain the increased prevalence of diabetes in women with PCOS. 6 main defects are: number 1, the insulin resistance in at least 50% of PCOS cases appears to be related to the insulin receptor, which is technically called as post-binding defect in insulin receptor signaling pathway. Number 2, adiponectin is a hormone which is secreted by our fat cells that regulates our glucose levels. Now, lean and obese women with PCOS have lower adiponectin levels, making the insulin resistance worse. Third point, insulin is known to be a metabolic as well as a reproductive hormone. Yes, its receptors are present in human ovaries. Insulin resistance is seen in the ovaries too in PCOS women, besides in the muscle and fat cells. This causes abnormal glucose regulation with increased hormone synthesis within the ovary. High insulin levels in synergy with higher luteinizing hormone contributes to the absence of ovulation in PCOS. The fourth defect, insulin causes elevations in free testosterone. In return, this worsens the insulin resistance in PCOS. Coming to the fifth defect, insulin resistance may result in decreased satiety in PCOS. Now, eating more than needed can further contribute to the weight gain, creating a vicious cycle. And the last defect, women who have type 1 diabetes along with PCOS have insulin resistance due to insulin therapy. Now, let's discuss the thyroid hormone dysfunction in PCOS. Thyroid disorders and PCOS are closely associated. Studies show that in PCOS patients, the level of the TPO antibodies and the prevalence of clinically proven goiter were higher than those without PCOS. Hypothyroidism also has a component of insulin resistance. Thyroid hormones are needed for glucose utilization in the tissues. Lower thyroid hormones in the blood lowers the sensitivity of the tissues to insulin. Now, patients who are on levothyroxine therapy with normal T3 and T4 and high levels of TPO antibodies show higher insulin resistance. This has been associated with an inflammatory state which is usually seen in autoimmunity. Together, all this means that insulin does not work well in PCOS. It can cause and maintain the hormonal imbalance. It can also lead to weight gain, which makes the imbalance worse. Besides, hypothyroidism can also accompany PCOS, which we normally see. These are some of the reasons why women find it difficult to lose weight in PCOS. This does not mean that the lean women are spared of the other negative effects of the high insulin levels. The flow chart summarizes the disturbances explained. Speaking of carbohydrates or carbs are found in foods such as cereals, grains, dals, pulses, fruits, stable, sugar, honey, jaggery, starchy vegetables like potatoes, and there are smaller amounts in milk and dairy products. Our body breaks down all these carbohydrates into glucose or fructose if it's coming from fruits. What happens next? The body needs insulin to process glucose. Excess glucose and the excess circulating insulin further lead to insulin resistance and weight gain, which are adding up to the fat stores. Carbs also have a lower satiety value. Imagine eating 1 chapati and 100 grams of chicken. They approximately have the same calories but have different satiety values. This means that you can definitely end up eating more carbs than you actually need. Experience tells us that moderation always fails when it comes to carbs. You need sizable willpower every single time to stay within your limit. This can get tiring, isn't it? If insulin does not work the way it is supposed to in PCOS, why would you want to lower glucose from dietary carbohydrates and make it worse? How does one improve insulin sensitivity? Lowering carbohydrates on a daily basis actually improves insulin sensitivity. This means that the body will use the available glucose better, especially on cheat days. Exercise also helps muscles dispose the glucose. So together, lifestyle changes and medications that are directed at improving insulin resistance and lowering body fat will reduce the adverse effects of high insulin levels and improve fertility in women with PCOS. I hope you found all this information useful. If you like this video, please like, comment and share. You may also subscribe to the channel and hit the bell icon for more updates.